Today, you're going to learn how I helped a patient shrink her thyroid nodule by 95% in 9 months. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And I've had the opportunity to help over 100,000 people over the last 35 years, many of whom have thyroid and digestive issues. And this one woman, 51 years old, came in with multiple thyroid nodules, Hashimoto's, weight gain. She had gained over 40 pounds, joint pain, hot flashes, brain fog, indigestion, heartburn, and a whole host of other symptoms. She had been to other doctors. They said her thyroid hormones were fine, so they just diagnosed her with chronic fatigue syndrome and prescribed some medication to lose weight. And that was it. She was still feeling miserable. So she came in, did an evaluation, and I ordered some testing. And what I look for under 5 broad categories to determine underlying root causes of why she was having thyroid nodules. They just don't come out of nowhere. There's some underlying cause. So we look at these 5 broad categories: deficiencies, toxins, infections, hormones, and food reactions. So in her case, and this is commonly what I see with patients that have thyroid nodules, is under deficiencies. She had vitamin D deficiency, iron, zinc, magnesium. She also had an iodine deficiency, and iodine is the most common cause worldwide of thyroid nodules and goiter. Toxins, she had high levels of fluoride, which can interfere with iodine absorption and contribute to thyroid issues. She also, under infections, had candida, yeast overgrowth, something I commonly see with thyroid issues. And under hormones, had adrenal dysfunction, below optimal DHEA levels, and cortisol levels. And then under food reactions, and I've seen this with almost every thyroid patient, especially with nodules, gluten sensitivity she had, also leaky gut. So when someone has a gluten sensitivity, that can lead to leaky gut, which then can cause more food reactions, thus perpetuating that whole cycle. And that's a common trigger for autoimmune conditions, especially Hashimoto's. What do we do once we find all this out? Well, number one, we address diet, okay? So the diet that I use, I call it the free diet, because it's not only free of gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So it's free of those foods most commonly responsible for inflammation, gut and thyroid, and other chronic health issues. And also, we use specific supplements to correct any deficiencies. And we start out with, well, the functional 5, I call it, which is multivitamin D, fish oil, magnesium, and probiotic. And then beyond that, based on the individual, and I commonly see this, as was the case with her, in patients with thyroid nodules. So iodine, if you are tested and you're low in iodine, that can be very helpful. If you are not low in iodine and end up taking it, it can be counterproductive to thyroid issues. So, and then when you're taking iodine, now I had her take a relatively large dose of 10 milligrams. And again, she also had Hashimoto's. So when you're taking iodine, it's important to check your thyroid levels and antibodies regularly, which we did with her. And selenium, you want to take when you're taking iodine. Zinc, iron, she was low in iron, so we had her take that. Vitamin C and acetylcysteine. For digestive issues, so she took gastroenzyme, it's a digestive enzyme that helps you break down and absorb your foods. Methylfolate, because I often see issues with low folate or B12, and that can help with also without methylation detoxification. Curcumin is helpful for inflammation and immune support. And then we do adrenal support formulas if needed, like it was the case with her hormone, balance the hormones, so hormone balance formulas if needed. And she followed this, and over the following months, her symptoms were clearing up. I mean, she had more energy, less fatigue, and the things that resolved, that got all better, were indigestion, heartburn, brain fog, headaches, joint pain, dizziness, anxiety, insomnia all cleared up, hair loss was better, hot flashes gone, heart palpitations, shortness of breath, itchy skin, acne, all these things cleared up over the following months. And when we did, and her lab values also improved significantly. She had a follow-up ultrasound done at 9 months, and I was thrilled to see that her larger thyroid nodule, which was almost 2 centimeters, had shrunk by 95%, and then the two smaller ones that were less than a centimeter, they shrunk by 54 and 82%. So I was thrilled to see that. If you have thyroid nodules, I would suggest getting started on at least the free diet. I can put a link down below for the free diet phase 1 food chart if you want to get more detailed information on the diet. There's also a chapter in my book called The Free Diet on thyroid nodules and what everything we just talked about in detail. Check that out too. But in the meantime, get started with the free diet. I'll put a link below for a free copy of the phase 1 food chart there. And some common the supplements that we had talked about, you can get started with those. Just start searching for your underlying root causes, okay? And then you can start finding out what solutions can help these clear up, because like I said, with thyroid nodules, they just come out of nowhere. There's some underlying root cause. They come from somewhere. So start addressing those, and oftentimes you can improve and get better. The body has an amazing ability to heal itself. So address some of the underlying root causes. Oftentimes you can get better and improve. So thanks very much for joining me today, and I look forward to seeing you next time. Take care.